Good evening, I'm Tevon, and tonight the American health system has been shaken to its core. A wave of sudden, sweeping layoffs has struck federal health agencies across the country. This morning, thousands of dedicated public servants arrived at work, only to find they could no longer enter the building. Their jobs gone, just like that. Some were notified by cold early morning emails. Others had no warning at all, until their security badges simply stopped working. In total, 20,000 jobs are now gone, part of a brutal reduction led by Health and Human Services Secretary Robert F. Kennedy Jr. That includes 10,000 full-time staff laid off just this week, and another 10,000 who left or were pushed out earlier in the year. Among the impacted, scientists, senior leaders, equal opportunity officers, HIV prevention workers, press liaisons, child welfare advocates, civil rights enforcers, even entire regional teams who worked directly with the most vulnerable Americans. Dr. Robert Califf, former head of the FDA, didn't mince words. He wrote, "The FDA as we've known it is finished," and then added, "There is no good reason to treat people this way." Others described the scene as nothing short of a bloodbath. Dr. Mandy Cohen, who led the CDC during the Biden administration, warned, "This leaves the U.S. less safe, less prepared, and without the expert hands needed to fight future health threats." And what's most heartbreaking is the human cost. One FDA staffer told us, "Everybody's got families, mortgages, real-life concerns, and now we don't even know what's next." Another employee received a severance letter listing incorrect performance scores, reducing their benefits unfairly. Was it a clerical error? Or something worse? We don't know. They don't either. The agencies affected read like a who's who of America's health defense system. FDA, 3,500 staff cut, including entire press teams and drug oversight personnel. CDC, 2,400 cut, including experts in workplace safety, chronic disease, HIV, and injury prevention. NIH, 2,200 cut due to internal restructuring. CMS, 300 staff cut, including the entire Office of Equal Opportunity and Civil Rights. Office of Minority Health, website offline. Staff vanished. Low-income home energy. Assistance. Program. Entire team terminated, jeopardizing the future of a program that helps millions of Americans keep the heat on in winter. Chiquita Brooks LaSure, former head of Medicare and Medicaid, said it plainly, "We have health disparities in this country, and we need to be measuring and addressing them, not erasing the very teams that do that work." One particularly gut-wrenching detail: laid-off employees from the Civil Rights Office were told to contact their former director for complaints. That director had passed away 4 months ago. This, according to former CMS executive Karen Shields, is a tragic reflection of a system that's being dismantled without care, coordination, or compassion. Even high-level officials weren't spared. Dr. Jeanne Marazzo, director of the National Institute of Allergy and Infectious Diseases, was informed she could either accept reassignment to the Indian Health Service or relocate to remote regions like Alaska or rural New Mexico. Others were offered sudden reassignments, while still more were simply let go. Secretary Kennedy has defended the move, calling it a necessary reorganization, saying the goal is to reduce bureaucratic sprawl and focus on fighting chronic disease. He promises the department will do more with less, but critics argue the exact opposite is happening. Instead of streamlining, we're shredding the very safety net millions rely on. One staffer from the Administration for Children and Families told News Xstream, "We work directly with families in need, refugees, homeless teens, Head Start programs. Now, we've been cut off from the work we love and from the people we serve." They added, "Our fear that this will make childcare less safe and less affordable. Once 82,000 strong, the federal health workforce is now down to 62,000. That's 20,000 fewer voices advocating for public health, for equity, and for everyday Americans. Tonight, the halls of America's health agencies echo with silence where experts once stood. This is more than just a reduction in force. It is a rupture in our national capacity to care. We will continue to follow this story, for the people affected, for the programs at risk, and for a country that must ask, what happens when the safety net is cut and no one is there to catch us? I'm Tevon. This is News Xstream. Stay informed, stay engaged, and most of all, stay compassionate.